34 rapid diagnostic tests, RDTs, were brought for validation. She said the acceptable criteria for the RDT kits is based on a sensitivity and specificity.
From 16th April 2020 to 17th July 2020, we have received 34 RDTs for validation. These RDTs have come in from Ghana, one from Ghana, China, USA, Canada, Korea, Finland, Malaysia, Singapore, and the UK. I will just give you an idea of what we have so far for all of them. Taking all of them into consideration, we have a specificity of between 85 and 99%, and a sensitivity of between 4 and 54%. Please bear in mind that I said an RDT that is validated should be 99% before it is considered acceptable for use. So as of now, all the RDTs that we have tested are ranging between 4% and 54% sensitivity and 85 and 99% specificity. Thank you very much.
And President Akufo-Addo has inaugurated a community water project at Yape as part of a 2-day working visit to the Savannah, Northeast and Northern regions. The project will provide access to potable water for more than 18,000 persons across 5 communities in the central Gonja district of the Savannah region, including Yape, Yipala and Fufoso.
While on his 2016 campaign tour of the Northern region, President Akufo-Addo made a promise to extend access to potable water to Yape. This followed an appeal from the Yape Ura to then flag bearer Akufo-Addo to extend access to potable water to the people of the area if he won the election. 4 years from this pledge, and President Akufo-Addo has fulfilled his promise and extended it to 4 other communities in the area. The facility undertaken by the Community Water and Sanitation Agency is part of the additional financing under the Sustainable Rural Water and Sanitation Project. It comes with 4 hybrid pumps, 28 pipes, a treatment plant and a solar farm. Sanitation and Water Resources Minister, Madame Cecilia Dapa, says the Yape Water Project is part of a broader vision by the President to increase access to potable water to Ghanaians.
It is the policy of the government to coordinate all our water supply systems such that Yape community and its environs will also benefit from the Damango Water Supply Project, which has a component to for the construction of ground-level reservoir, storage, and elevated water tanks to serve the towns from Yape to Damango. In the last 3.5 years, the government of the New Patriotic Party has been working tirelessly to deliver water infrastructure to the good people of Ghana.
The project was funded by the World Bank as part of ongoing support to increase access to water to more Ghanaians. The World Bank Country Director is Mr. Pierre Laporte.
The bank has supported the water and sanitation sector in Ghana with several projects over the years. For the rural and community water subsector, we started with the first community water and sanitation project in 3 regions from 1996 to 2000. And this sustainable rural water and sanitation project, which comes to a successful closure today, is the 4th in the series.
President Akufo-Addo was happy that the completed project had been delivered as promised.
The Yape water supply system will serve 11,443 people and has been constructed at a cost of 5,665,966 cedis and 42 pesos. One way to help improve the longevity of the treatment plant is for all of us collectively to protect our water bodies by stopping activities such as galamsey, sand winning and farming along river banks, all of which lead to their pollution. This would help guarantee improved water supply in terms of quality, quantity and reliability to the people of Yape and surrounding communities. Waterborne diseases such as guinea worm, cholera, and dysentery would also be eliminated. I'm hopeful that this water supply system will also go a long way to enhance our collective efforts at protecting ourselves from the COVID-19 pandemic.
The chief of Yape, Soale Alasan, commended President Akufo-Addo for fulfilling his promise and appealed to the president to build a fire service station and a senior high school in the area.
You're watching News Hour. Ghana's HIV prevalence rate currently stands at 1.7%, and this means a marginal increase of 1.69% of the 2018 figure, and translates into an estimated 342,307 people living with HIV. The Director General of the Ghana AIDS Commission, Mr. Chairman Etiahene, announced this at the launch of Ghana's HIV estimates in Accra.
Of the number, 122,321 are male, translating into 36%, with the remainder, 219,986 being women, accounting for 64%. Per the regional breakdown, Boni region topped with 2.66%, followed by Greater Accra region 2.47%, and Eastern region with 2.07%. Upper East region recorded the lowest with 0.72%. In terms of the district breakdown, Okaikwe North in the Greater Accra region came first with 7.50%. La Nkwantanan Madina, also in the Greater Accra region, came second with 6.60%, and Kwadaso in the Ashanti region with 6.40%. During the same period under review, an estimated 20,068 new infections were recorded, with 85% of the cases recorded in the adult population. The national prevalence of 1.7%, says the Director General of the Ghana AIDS Commission, Mr. Chireme Etiahene, is not the best.
We want to eliminate the epidemic by the year 2030. And if we are still seeing that about 342,000 or more people live with HIV, and the prevalence is 1.7%, we want to see the prevalence coming down to less than 1%. Until we move towards zero, we cannot be complacent.
In an interview, Mr. Chireme Etiahene said Ghana AIDS Commission will soon roll out a national strategy aimed at helping the Commission to achieve an epidemic control as targeted in 2030. The Commission will soon begin mass testing of people to identify those who might be living with the condition unknowingly. The current HIV estimate shows that some 142,000 people are living with HIV without knowing their status.
We are also adding the community level testing to ensure that people who will not normally go to hospital because they are not sick can also be tested.
Despite the complaint of some persons living with the disease of a shortage of the ART, the AIDS Commission assured patients on the antiretroviral therapy that there is enough stock to enable them stay healthy. Gifty Echi, GBC News, Accra.
The NDC says under its watch, when voted into power, it would grant each Ghanaian free health care. The pledge was among a list issued by the party's flag bearer, Mr. John Mahama, at a ceremony in Accra to outdoor Professor Nana Jane Opoku Ajiman as the party's running mate for the 2020 race to the presidency. Napoleon Atokito reports.
The surprise factor in recent Ghanaian politics, following the unexpected announcement to be running mate of former President John Mahama in the coming elections, has sequenced the enigma by herself. At a ceremony in Accra to outdoor her to the electorate, the largest opposition party placed on the table heavy pledges which it says would enter secret social contract with the people to better their lot. the NDC pronounced that it will issue free universal primary health care to all Ghanaians, establish a financial services authority to streamline all financial dealings between institutions and clientele, commit top appointees to the uncharted waters of assets declaration, tweak the Article 71 of the Constitution to iron
back upon. The involvement of women in the decision-making process will not end at the level of the Vice Presidency. We will work again towards the attainment of a minimum of 30% of all appointments going to women. We have an opportunity in this election as Ghanaians to fully give meaning to gender equality and also to have a highly educated and disciplined woman placed in a critical position to influence policy, our nation's destiny.
As for the poor sound quality there, we'll work on it and get back to you with that story soon. Political communicators in the Upper East region have been equipped with basic communication skills and updated on issues of governance at a program in Bolgatanga. It forms part of an integrated effort to improve on the communication bureau of the various political parties.
The training centered on constructive discourse and ethical campaigning ahead of elections 2020. The executive director of Ramnet, a development communication organization in Tamale, Mr. Kasim Perez, said the actions of foot soldiers and the youth are influenced by utterances of their party communicators. He said weak debating skills, intolerance and truth and poor communication strategies contribute to election violence. For these, he says, skills in communication are important.
Because most of these foot soldiers do not understand the issues, normally it degenerates into arguments, which further degenerates into violence. So this training workshop was aimed at party communicators. We trained them in strategic political communication.
Participants were grateful for the training and promised to be circumspect in their utterances as the elections approach. They observed that the development of the region was paramount and relied on their actions and inactions. They called for more opportunities in such programs. There were participants from the National Democratic Congress, New Patriotic Party, People's National Convention, Convention People's Party, and All People's Congress, among others. Ramnet collaborated with the Coalition for Peaceful Elections and Development and the West Africa Network for Peace Building, WANEP, for the program.
The Ministry of Fisheries and the Coastal Development Authority have presented 300 subsidized outboard motors to fisherfolk in the central region. We'll bring you that story later. Through their own initiative, the people of Abesim in the Sunyani municipality have put up a fire station. ACFO Parkwesi Educhum commended the people, saying the new fire station is the 198th in the country. He said there are still about 87 districts in the country with no fire stations. The facility has been inaugurated at Abesim in the Bono region.
For the people of Abesim, the motivating factor to put up a fire station was the frequent fire outbreaks and accidents in the area, some of which claimed lives. The chiefs and people, fire service personnel, security and government officials were proudly represented at the inauguration. In his address, the chief of Abesim, Berima Kumie Chow, said he was personally motivated to execute the project because he lost 2 relatives through domestic fires, while frequent fire mishaps have wreaked havoc in Abesim over the years. He urged the fire service personnel to effectively maintain the facility and employ some locals to reciprocate the gesture. ACFO Parkwesi Educhum, representing the chief fire officer, commended the people of Abesim for supporting the fire service since effective fire prevention and fighting
before it gets out of hand and cause havoc. Government has given the service a firm assurance of procuring some new fire engines for the service in the not too distant future. And I wish to assure all that when the new fire engines arrive, Abesim Fire Station will be on the priority list.
Of the 254 districts in Ghana, there are 198, becomes the 198th and latest in the country.
On that fire story, we take a break.
NBSSI, Mrs. Kosi Yankiaye, has indicated that 60,000 Ghanaians have so far received funding to support their businesses as part of the Coronavirus Alleviation Program Business Support Scheme, CABAS. Mrs. Yankiaye said one challenge currently facing the board is the mismatch of names used to apply for the funding and that of the applicants' mobile money details.
Important to note that the Coronavirus Alleviation Program Business Support Scheme is still ongoing. As the Minister of Finance announced during his speech at Parliament, the region has had access to some funding, the top being Ashanti region, Central Eastern, Greater Accra region, Western and Volta region being the top 5 regions that we have disbursed funding to, in excess of 57 million plus. Other disbursements have been made as well, and we are waiting to collate all the others so that we can give a revised amount as to what has been given out. The program is moving along successfully. We've really focused on the ADOM loans because that's the numbers. Because if you look at the economy, 80% of our beneficiaries are the micro enterprises. And they are the majority that have also applied for the funding. So as much as possible, we wanted to pay close to 2,000 Ghana cedis. We've also initiated the process to start with the NIDASOR funding, which is those who applied above 2,000 cedis. And we are working very closely with access, and we'll get to people. There's been a lot of conversation as to, are we really disbursing? Yes, we have been disbursing. Some people claim with the names of the person who has applied. And it's amazing that over 30% of the beneficiaries usually do not have the names that they applied with on their Momo. So when we go out to make payments, we realize that the funds are returned back to us because the names do not correspond. So we have to now go back and look at over 20,000 applicants and see how we are going to reach them to ensure that the names they've given and the Momo they've given us really align. So every day we release some funds, we go on ahead, and we are working on that close. We've set targets for ourselves, and as much as possible we want to close so that we can be able to go through and see all the changes that we've made in the lives of the Ghanaian people.
The Monetary Policy Committee of the Bank of Ghana has maintained the policy rate at 14.5%. The policy rate used to be at 16% and was revised downwards to its current level and is expected to make cost of credit in Ghana affordable.
Policy and regulatory measures announced by the MPC in March and May have positioned the banking sector to withstand the shocks associated with the pandemic and to support businesses. These measures are working their way through the economy and are beginning to impact positively. So far, new advances for the first half of 2020 was estimated at 15.8 billion Ghana cedis compared to 12.1 billion to provide the necessary support in these challenging times.
The Chartered Institute of Administrators and Management Consultants Ghana, CIAMC, has indicated that it is working to sanction any member whose practice does not meet the ethical standards of the Institute. The board chair of the Institute, Mr. Paul Kwate Hammond, said this at the second annual conference of the Institute in Accra. The 2020 conference is on the theme, Admins the Pulse of the Office in Crisis Situation.
No matter what your training is, after a certain period, you become an administrator of some sort. So the duties of an administrator, and how it is done, you have to be able to organize the employees within the establishment. You have to make sure that all that they require in terms of facilities are available. Ethics, which we teach and propagate strongly. Ethics that is supposed to equip the person or our members to behave and act. And if you fall outside, it could excommunicate you and unlist you. At the moment, unlike others where you have to have a certification before you can practice. We are not there yet. We are trying to get an act of parliament that would enable us to have that authority to say that if you are not holding the certification, or if you are not abiding by the rules, you can have some kind of sanction against you.
You watch your News Hour live on GBC News, and this is the business segment. On the interbank market today, the US dollar maintained its value to trade at 5 cedis 68 pesos. The pound sterling gained 6 pesos to trade at 7 cedis 32 pesos. The euro made a gain of 8 pesos to sell at 6 cedis. $57 a ton.